Okay, good morning, everybody. Go ahead and get started with the bios. We have a great presentation on revenue cycle management optimization. Today we have Marcia, Carlson, and Wanda Prada presenting today from Encompass Health Solutions Incorporated. Marcia is one of the founding leadership team at Encompass. Prior to joining Encompass Health Solutions in 2016, Marcia worked in a multi-specialty revenue cycle company for more than 17 years, beginning as a coder, biller, supervisor after 3 years, and then for the last 7 years managed department with the staff of 30 employees. In addition to department management, she was also responsible for new client acquisition and maintaining current client satisfaction. Several new clients were added during her management tenure, as well as successfully implemented new billing software and new scanning software. Marcia is certified in healthcare compliance and as an anesthesia and pain management coder. Marcia currently leads the business operation at Encompass Health Solutions and works closely with the team on the onboarding of new clients and implementation of projects and initiatives. She has been actively involved in the creation and implementation of the revenue cycle optimization program and in partnership with USET since 2018. And Wanda joined Encompass Health Solutions in 2020 with over 18 years of revenue cycle experience. Wanda has a BS in biology and is certified in revenue cycle as a professional outpatient coder, orthopedic surgery coder, and medical auditor. She has worked in all areas within the revenue cycle, which has given her a broad depth of hands-on experience. This experience allows her to effectively develop and implement trainings, workflow improvements, compliance plans, and policies and procedures. Wanda has worked with several Indian Health Service areas to include Alaska, Navajo, Phoenix, and most recently Nashville. Welcome, Marcia and Wanda. And we'll go ahead and get started. Oh, let me admit other people. Give me just a minute. Okay, so they're in. If y'all want to go ahead and share your screen and start your presentation.
Okay, good morning, everyone. We're excited to be here today to present this session on revenue cycle optimization in the tribal healthcare clinic setting. Encompass partnered with USET in 2018 to implement a revenue cycle optimization program. And this really came about after a GAO report that indicated, for a number of reasons, that there was a large amount of revenue uncollected across all tribal nations. So our goal has been to partner to provide training and support related to coding and billing so that those uncollected third-party dollars can come back to the clinic and be used for increasing services to tribal citizens. So today we want to share a few of the key best practices and include some recommendations on how to identify opportunities and implement solutions to ultimately improve your third-party collections. And so we're going to start today with a brief overview of the revenue cycle. So what exactly is the revenue cycle when we talk about that? So the official definition is the set of all administrative and clinical functions that contribute to the capture, management, and collection of patient service revenue, both efficiently and accurately. So as you can see in the graph we have on the screen today, this shows the steps of the revenue cycle. The revenue cycle begins with that very first contact with the patient when they schedule an appointment. When they come for that appointment, that work at registration, making sure all of the needed and correct information is obtained from the very beginning is crucial to the rest of the revenue cycle process. After that happens, after the registration, then the patient is seen by the provider. And the provider at that time should document all the services that were provided to the patient. After that, those services need to be coded. So assign diagnosis and procedure codes, as well as any modifiers to help indicate what exactly was done. The billing process is then preparing the claim form and submitting to third-party payers for payment. After that happens, we need to manage those claims and post payments and contractual adjustments and review and appeal any denied claims that may come. And then accounts receivable management is the final step of the process. This is when we make sure that any unpaid or denied claims are reviewed and followed up on. And then that's when the revenue cycle ends, when that claim is fully adjudicated or processed and paid. So as you can see from this graph, it really is circular, and every step of this process is connected, and every step is so important to maintain a healthy revenue cycle. And so with that, I'm going to hand it over to Wanda to cover each of these steps of the process in more detail.
Thank you, Marcia. So like Marcia mentioned, we're going to briefly discuss all the different functions within the revenue cycle. So starting with registration, that's important. Accurate registration helps get patient data complete and clean as it moves throughout the organization. Patient demographic information can be gathered using the new packet form prior to their visit or at the time of the appointment. It is important to make sure that you're asking for and receiving the right information during the registration process, and that information must be accurately recorded in your system. Information must be reviewed and updated at every visit. You need to always make sure you are using their legal name. You should update patient address and contact information. Also, payer information. Having accurate responsible party information, correct health insurance policy information, and this includes policy holder, because sometimes the patient is covered under their spouse's or parents' policy, is essential for getting your claims paid and avoid any rejection. Scanning or copying the insurance card is the best practice to make sure you get the correct ID, group number, insurance address, even payer ID, which also helps choosing the correct insurance during your registration. After collecting insurance information, verify that the policy is active and that the patient is eligible and covered for your services. It's really important that your staff have access to the clearinghouse and payer portals to complete this task. If treatment is for an accident or an injury, there are a number of additional factors that need to be clarified. This is to include date of injury, whether the injury is related to an employment, auto accident, or any other type of accident. If a claim has already been established, ask for the claim number, the claim adjuster contact information, and where the claims should be sent. Once, if the patient is uninsured, you can refer them to your patient benefit coordinator. This will assist the patient in the process of obtaining insurance coverage, such as Medicare, Medicaid, or any other insurance within the marketplace. Once the patient is registered, you can move into the scheduling. Understanding the intent of the appointment is key to understand and use appropriate resources, such as which clinic we're going to be using and or provider. Also, the length of the time needed for these services. Adding specific comments to the appointment is a good practice as well. Examples of additional information could be, this is a new injury, this is a follow-up, a well child, vaccines, or labs. Checking in the patient is important as this will generate an encounter for this visit. Checking out the patient is also important. This confirms that the patient was seen. Completing these two steps allow a reconciliation between patients that have been seen and the no-shows, which is often used for productivity metrics. Now, the next step is clinical documentation. So this is when the provider sees the patient. Providers should focus on taking care of the patients and accurately documenting their services. Clinical documentation is the foundation of the patient's medical record, as it captures all aspects of your patient care. When the documentation is complete, detailed, and accurate, it prevents ambiguity of diagnosis and treatment and improves communication between healthcare providers, coding, and billers. The rule of thumb for clinical documentation is, if it isn't documented, it didn't happen. Providers or clinical support staff must understand documentation requirements for the services they will be providing. For example, evaluation and management codes are based on the type of visit. So we have sick office visits, well child, well woman exam, annual wellness visit, just to mention a few. And also it's important to recognize whether this is a new or an established patient. Procedures notes must be clear, concise, and should include the site of location of the procedure, the size, depth, severity, just like simple, complex, or extensive. Also, type of anesthesia is used, and the method used like incision, excision, biopsy, or etc. Some services are considered time services, and for this, the time spent performing these services is required. Some of these examples are psychotherapy, diabetes education, medical nutrition, telephone, telemedicine infusions, and others. Other services are required to be entered in specific areas like immunizations. So make sure that this information is entered, for example, in the wellness tab, as this impact reports that the patient may request in the future. Progress note completion. Documentation for each patient encounter should include at all times chief complaint, history of present illness, physical examination findings, assessments, clinical impression, and or diagnosis. Providers have an obligation to document conditions to the full extent of their clinical knowledge of the patient's health. Medical necessity and quality of care must be clear and detailed, along with a plan of care. Signatures of providers and our clinical support staff providing services are required at all times. It is important to review and update the integrated problem list, or the IPL, for each patient, as it will represent all problems that have been documented. When ordering services and or procedures, the documentation must support the medical necessity and the provider intent. So we need to make sure that these orders are complete to include not only the specificity of the lab or the diagnostic test order, but also the diagnosis. Progress notes must be completed timely and following Indian Health Services policies. Best practice to maintain an accurate medical record is to document services during the encounter or as soon as possible right after the visit. Now let's move into coding. Coding also has a rule of thumb that completes the one from the clinical documentation. And if it didn't happen, it can't be coded. Coding has been recognized as one of the core health information management functions within healthcare, because coding professionals are frequently faced with ethical coding, coding-related challenges, and complex regulatory requirements. Best practice is to hire certified professional coders. Certified professional coders are responsible for reviewing the patient medical record after each visit and translating the information into codes that payers uses to process the claim. Coders should review all supporting documentation in order to assign appropriate accurate diagnosis and procedure codes. They will apply coding guidelines, not only by services, but by specialty and by payer. Understand national correct coding initiatives to append modifiers accurately. They will report only the procedures and diagnosis clearly and consistently supported by the documentation. And they should be able to identify and validate medical necessity. Coders also have the responsibility of querying the provider for clarification or additional information as needed for accuracy. Educate your providers on any documentation deficiencies to avoid repetitive behavior is also a responsibility of the medical coder. They also have the responsibility to keep up with the ever-changing medical coding world. Accurate coding leads to clean claims, which results in prompt reimbursement, which take us to our next step, which is billing. Medical billing is an important component of practices, ensuring smooth operation of the revenue cycle. They are responsible for handling and transferring patient information, submission of claims to insurance companies, and also ensures that the payments for medical services are received in a timely manner. Medical bills should recognize ICD-10-CM codes, CPT, HCPCS codes, and modifiers, at least the ones that have an impact in the revenue, such as GT or 95 for telemedicine, and the most audited modifiers 25 and 59, among others. Understand the different claim formats and completion requirements for each one of them. The clinic or practice designation will determine the claim format to be used. UB04s are used for institutional claims, FQACs, and RHCs. CMS 1500 form are used for professional and outpatient claims. Medical billers should also understand insurance guidelines. This is important to avoid delays and denials. For example, nowadays we have COVID vaccines. These are not billable to Medicare Advantage. These are billable to regular Medicare. So this is one of those examples where knowing those insurance guidelines determines whether or not a claim is going to be reimbursed correctly. Claim must be reviewed and approved daily or as soon as they are available. This has a direct impact into the cash flow of the practice or organization. And that takes you to claims management. Claims management is often performed by medical billers. Effective claim management process not only requires an understanding of how to negotiate payer contracts, but depends on familiarity with the complex and proprietary rules of each insurance company. Claims management professionals must have knowledge of basic correct coding guidelines and timely filing methodologies. They should know the current fee schedule of the organization. Posting payments timely provide insight into a practice revenue stream. Understanding different types of adjustments and know how to post them accurately. Indian Health Services has developed a standard adjustment reason codes crosswalk to the appropriate adjustment category and type to facilitate accuracy and consistency while posting the adjustment. So this is the SAR codes to match adjustment codes and types, and this could be found in the accounts receivable user manual. Claim management professional also should promptly research rejected claims and appeal denied claims. Now, a rejected claim is one that hasn't been processed yet due to the discovery of one or more errors. A denied claim is a claim that the insurance company has processed and has deemed unpayable due to the discovered violation of the payer-patient contract or some other error caught after processing. Knowing this difference is important as they will just trigger how we're going to approach and complete this claim. They should be able to talk to the insurance companies about payment discrepancies, keep track of denials and rejection trends, and share them with the revenue cycle team. This is always a learning opportunity. Unpaid claims with no payer response should be followed up regularly. These claims should be forwarded then to the accounts receivable management staff or department, which is our final step within the revenue cycle. The primary goal of accounts receivable management in healthcare is to maintain maximum cash flow into the practice by minimizing the collection period and the costs associated to it. Accounts receivable management is a collection of processes such as identifying denied unpaid claims, refiling corrected claims, minimizing AR days, eliminated aged AR, and establish an effective collection process. The average days of a claim in the AR should be less than 35 days. Unpaid claims that have not received a response from the payer should be followed up within 30 to 45 days of submissions of the claim. This timeline will vary payer to payer and also depends whether the claim was on paper or electronically. It is key to run, review, and analyze AR reports frequently to keep track of trends and fluctuations by payer and/or services. Some of the most common reports are unbilled claims report. You want to know how many claims are waiting to be released, who is responsible, and also it can identify any issues preventing this claim to be processed or transmitted. Aging report. This report tracks how long a claim takes to process and identifies the process for each payer for future reference. Adjustment report is necessary to ensure that the provider and/or practice is receiving all payments to which they are entitled. This report can track non-covered services, coding errors, prior authorization issues, errors in payment, and contractual adjustments irregularities. Establishing a clear collection process is also part of the AR management, and this is when and if applicable. So this concludes the revenue cycle overview. I will now handle it over to Marcia for the remainder of the presentation.
Marcia, you're on mute.
Thank you, Brian. As Wanda has now completed the revenue cycle process, going through all the details of each step, the last thing we want to talk about today is key performance indicators. So how do you measure those steps of the revenue cycle process and how you're doing throughout each step? So when we look at key performance indicators, one of the things that we always monitor are charges and receipts. So watching for inconsistencies. If there are large spikes or dips in either the charges or the payments, this could indicate a backlog of posting or some other issue behind the scenes, and it affects the consistency of your revenue. So it's something that you definitely want to monitor on a monthly basis, even on a weekly basis, to make sure that consistency is there. The gross collection rate is also really important, and this typically stays fairly consistent, but it can fluctuate based on maybe a shift in your payer mix, or a lower gross collection rate could also indicate an issue where claims were denied and written off completely due to either lack of follow-up or true denials that are going to never be paid. Either of these situations should really be investigated, and the issue should be addressed for the future to make sure it doesn't continue to happen. Aging accounts receivable and days in accounts receivable. Wanda covered this a little bit as far as the days in accounts receivable, that they should be less than 35. But these are really important to monitor as well. These are numbers you don't want to see increasing, because that means your claims are not being paid timely and your accounts receivable balance will just continue to grow. So you should definitely look into any accounts receivable days in AR, especially over or aging over 90, because those are when the claims are going to start not getting paid due to timely filing requirements from payers, both timely filing for submission and timely filing for appeals. So you have to watch very carefully that aging to make sure that it is not increasing and that your team is actively working those unpaid claims and get them paid in a timely manner. We strive to see really 15 to 20% in aging over 90 days. That means that the bulk of your accounts receivable is still in the current stage and very likely to be able to get paid. So days out coding, days out billing, this helps you see if there's that backlog in either the coding or the billing process. And so we really like that to stay consistent as well, because that leads to consistent revenue. The number of visits. So you can look at this in a few different ways. Monitoring the number of visits by provider. You can look at it by visit type or by location if you have multiple locations. It just helps you see the different visits, especially by provider. You can kind of see how they are seeing patients and how many patients they are seeing on a regular basis. Is it certain days that are more have more patients than others, or you can kind of just watch that flow to see how that is working. The payer mix is also important. It's important to keep track of your biggest payers and if this is shifting in any way. Another facet of this tracking is your uninsured patients, and watching to see if any of these uninsured patients might be eligible for either Medicare or Medicaid, therefore being able to bring in those third-party dollars. When we look at verification of benefits, we mean we're tracking to make sure the front desk or registration is verifying eligibility for each patient who is insured. This is typically done through a clearinghouse or through some eligibility check that you have access to. And that really helps us make sure that a clean claim can get out the door and get paid timely. There are a lot of other metrics you can monitor, such as denial rate, a clean claim rate, or a cost per claim, among many other things. So you need to take a look and see what works best for your clinic. What do you really want to monitor? And we recommend starting out just even monitoring a few different things just to see where the consistency is, if there are any issues, and looking into those issues to make sure that things can improve. This slide really just shows how it can look when you're monitoring KPIs. So it's perfect when it can be visual like this, because that resonates with most people, to be able to see it in color and to see a graph. It's easy to pick out those spikes in the dips so you know what's happening within your practice. And then by implementing these best practices, we expect to see results such as increased efficiency in the billing, the coding, and the collections, and increased total billed and collected third-party dollars. And then, as we mentioned in the beginning, an increased capacity to provide quality healthcare to your tribal citizens. And as we close out this session today, the summary of key elements for successful change are implementing the best practices to increase efficiencies, instituting those KPIs, and leveraging that power that comes from understanding that data. And if you're not currently monitoring any KPIs or metrics, like we just talked about, we really recommend picking a couple to start with and just start watching those and start digging into any inconsistencies that you see. And then reinforcing that change through audits, training, and education, that will definitely help to optimize your revenue cycle processes and increase your clinic revenue. And that's what we have for today. Our contact information is on the screen, and it is available. If you have any questions or want any further information from us, please don't hesitate to reach out.